Hello, this is Kirti from Kirti Institute. In today's video, we are going to discuss on information giving. This is one of the OET assessment criteria for speaking subtest. If you haven't seen my last video on information gathering, please watch it. Now, let's begin with information giving. So while giving the information to the patient, it is essential to identify what the patient already knows. Okay, and we need to do that for three main reasons. First of all, we don't want to repeat the information that patient already knows. Second, we don't want to contradict the information that patient might have received from another healthcare worker. And lastly, we want to provide patient-centered care, and that is why it is important that we know what the patient already knows about the condition. So you may always ask that, what do you know about? Okay, what do you know about diabetes? What is your understanding for asthma? Okay, so this is how you can establish what the patient already is aware of. Second point is chunking and checking. That means taking pause and try to understand if the patient understands your information. Okay, and it is really important. Okay, don't just give bulk of information at a time. Okay, just don't give lot of information without pauses. In this case, patient may not be able to understand what you are conveying. Okay, so rather than that, just take a pauses. Let me explain you with some live example. Okay, suppose you may say that, okay, let me discuss on squamous cell carcinoma. It is one kind of skin cancer which occurs because of excessive exposure to sunlight or ultraviolet radiation. That means it is important that you keep protecting your skin when you are out. Do you think you will be able to provide appropriate information to the patient? Yes, your information is appropriate, but not in a right way, right? You need to take small pauses for that. So you may rather say that, okay, let me explain you what squamous cell carcinoma is. It is one kind of skin cancer which is caused by excessive exposure to sunlight or ultraviolet rays. Okay? Now, that means it is important that you keep protecting your skin while you are out under the sun. Does it make sense? Okay, so you are first taking pauses and trying to explain all the points one by one, and then you are checking, does it make sense? Are you following me? Is that clear to you? Okay, so that will help the patient to ask questions if patient has not understood, and that is what you need to do. Okay, you need to encourage the patient to react or show their feelings. So if you're asking the questions, okay, it will be easy for the patient to get involved into the communication. Okay, so suppose you are asking that, are you following me? Is that clear to you? You may say like, let's take insulin. Okay, we have discussed on self administration of insulin. So do you think you will be able to manage it? So patient will react okay on your question, and that is what we want. Otherwise, what will happen? Your communication will be monotonous, right? The patient will not get involved in the conversation. So it is always better that you encourage the patient to do so. And lastly, you can always encourage for the further information. Okay, like do you want to know more about something? Okay, or do you have any other concerns? So like that, you can encourage the patient to involve if something is left over. Okay, so you can always do that. Let me repeat what 5 points we have discussed. First is establishing what the patient already knows. Second, chunking, that means taking pauses, checking whether patient understands your communication or not. Okay, fourth is encouraging the patient to show their feelings or encouraging the patient to react. Okay, and fifth is asking for further information. I hope it is clear. If you want me to make more videos, please write topics into the comment box and I'll be there with more information. For today, that's it. Bye bye.